If you are over the age of 65, or you care for someone who is, I want you to listen very carefully to this video. What I am about to share with you is based on patterns I see every single week in real patients. These are not rare findings. These are not extreme lab results. These are subtle blood test changes that are often ignored. But when I see them together, I know that someone is becoming more frail and that their long-term health outlook may be more limited than it needs to be. Today I want to talk about 3 very common blood tests that quietly predict decline in adults over 65. These are blood tests that the medical system checks routinely but rarely explains properly, and that is a problem. Because early decline does not announce itself loudly. It whispers. And if you know what to look for, you can act early and change the direction things are heading. One of the most important skills in medicine is observation. Not just reading numbers on a screen, but noticing patterns over time. Seeing how the same small abnormalities repeat themselves in people who later lose strength, independence, and resilience. People over the age of 65 make up the majority of patients I see. And again, when someone is beginning to decline, these same 3 blood markers appear. Let us go through them one by one. The first blood test is sodium. Sodium is a critical electrolyte in the human body. It helps regulate fluid balance, nerve impulses, muscle contraction, and brain function. Most people are warned about having too much sodium, but in older adults, low sodium is often far more dangerous. A normal sodium level is generally between 135 and 145. What I frequently see in people becoming more frail is sodium drifting into the low 130s. Levels like 133, 132, or 131. This is often labeled mild hyponatremia. Because it is mild, it is frequently ignored. But it should not be. Low sodium at this level is associated with slower thinking, balance problems, increased fall risk, fatigue, and confusion. It is commonly linked to declining kidney function, heart failure, hormonal imbalance, chronic inflammation, and poor overall metabolic health. In other words, it often reflects that the body is struggling to maintain internal balance. If you are over 65 and your sodium level consistently runs in the low 130s, that is not just normal aging. It is a warning sign. The second blood test is albumin. Albumin is one of the most important proteins circulating in your blood. It helps maintain fluid balance, transports hormones and nutrients, and reflects your overall nutritional and metabolic status. The lower limit of normal for albumin is around 3.4. When I see albumin levels drifting into the low 3s, such as 3.3, 3.2, or lower, I pay close attention. Low albumin almost always tells a story. And in older adults, that story is very often inadequate protein intake combined with loss of muscle mass. This is one of the most common and under-recognized problems in people over 65. As people age, appetite decreases, meals get smaller, protein is often reduced. Over time, muscle mass is lost silently. This loss of muscle is one of the strongest predictors of frailty, disability, hospitalization, and loss of independence. As a general guideline, most adults over 65 should aim for at least 1 gram of protein per kilogram of body weight per day, unless there is a medical reason not to. For example, a person weighing 80 kilograms should aim for roughly 80 grams of protein every day. Whole food sources are best. Eggs, fish, poultry, lean meats, dairy products, and legumes are excellent choices. Protein powders and smoothies can be helpful, especially if appetite is low, but they should be minimally processed and low in sugar. Low albumin is not just a number on a lab report. It reflects the body losing its ability to repair, maintain, and protect itself. The third blood test is chronic inflammation. This is commonly measured using C-reactive protein and the erythrocyte sedimentation rate. In healthy aging, these markers are usually low, often in the single digits. But in people who are beginning to decline, I frequently see these markers mildly but persistently elevated. Levels in the mid-teens or low 20s are extremely common. This usually does not mean an acute infection. Instead, it reflects ongoing low-grade inflammation. Chronic inflammation accelerates muscle breakdown, damages blood vessels, increases the risk of cognitive decline, weakens the immune system, and shortens health span. It is one of the strongest predictors of poor outcomes over time. When I see low sodium, low albumin, and elevated inflammatory markers together, I do not think that someone is suddenly ill. I think they are on a slow downward trajectory. And the important thing to understand is that trajectories can be changed. These findings are not inevitable. They are strongly influenced by nutrition, movement, sleep, stress, and metabolic health. One of the most powerful protective factors over the age of 65 is maintaining muscle mass. That means eating enough protein and using your muscles regularly. Strength training does not have to be intense. Light resistance exercises done consistently can make a huge difference. Walking daily is one of the simplest and most effective forms of movement. Nutrition matters more than most people realize. A simple and effective approach is to build meals around protein and colorful plant foods. Aim for half the plate to be protein and the other half to be vegetables and fruits rich in antioxidants. You do not need extreme diets. You do not need to eliminate all carbohydrates. You need consistency and adequacy. Managing stress is also critical. Chronic stress drives inflammation and worsens metabolic health. Pay attention to sleep. Rest when your body tells you to rest. Do not ignore persistent symptoms. If something feels off, get it checked. Ask questions. Know your numbers. If you are over 65, these are blood tests you should recognize by name. Sodium, albumin, inflammatory markers. Track them over time. Do not accept repeated abnormalities as normal without understanding why they are happening. The goal of aging should not be just to live longer, but to preserve strength, independence, and quality of life for as long as possible. Now I would like to hear from you. If you are over 65, or if you help care for someone who is, leave a comment below and tell me whether you have ever noticed any of these blood test changes. If this video was helpful, make sure you like it and share it with someone who may benefit from hearing this information. If you want more videos like this that focus on protecting health and independence after 65, subscribe to the channel so you do not miss future updates. You will also find links below to my website, my health programs, and additional resources that many people find helpful. And if you are not already signed up for my free newsletter, I encourage you to do so. It is where I share practical insights that I do not always cover in videos. Thank you for watching, and I will speak with you again in the next video.